That's correct.
Hi. Hi, my name is Steve Davlos. Today we're going to be talking about the Affirmative Care Act, also known as Obamacare. And we're going to be talking about how, for the affirmative side, that we should do away with it, essentially get rid of it. Now, the Affirmative Care Act, well, the Affirmative Health Care Act, also known as Obamacare, was initially given with the idea that everyone should have high-quality access to health care across the United States. Now, this was a very noble goal, of course, and no one denied this at all. However, as we've seen in the past months since it's been enacted, initially brought in 2010, and actually accepted by Congress in 2012, that hasn't gone over exactly as planned. Now, according to the Congressional Budget Office, with an estimated cost of $1.3 trillion and a still malfunctioning website, this plan is currently not off to a good start. Now, initially, the American public had been given the idea that this plan would save us all money, as well as give everyone access to healthcare across the United States. But, as we've seen so far from malfunctioning website, which on launch day alone had locked out over 4 million people, according to Time magazine, and currently, as of rated by CNET.com, still requires $115 million to be repaired and updated, with current infrastructure requiring servers and a revamped website. This obviously is not going very well. Now, although there are some positives that they have governed over 7 million new policies with Obamacare, there are some issues. According to Forbes magazine, over 80% of these policies are still not paid for, which means that the initial price that you have to pay has not been covered, which means you wouldn't receive the policy. As well as that, there's also other price issues, and that many people's premiums went up. According to Forbes magazine, The Apothecary, in 49 states, there's an increased average of premiums of over 41%, which means that whatever you were paying before would now go up on average of 41%, with younger people under the age of 25, having an increase of over 62% on their premiums. So if you're a male in the age of 25 or under, if you're paying $172 a month, now your premium would jump up to $230 or $250 a month. That's almost a complete double in what you were paying. Now there are some good news in regarding to what you're paying. There are some big winners involving New York, Colorado, Ohio, and Massachusetts, where their premiums actually went down on average of 40%, 22%, and 21%. But there are other 8 states that everyone else's prices went up. In terms of Nevada, which you had an increase of 179%, Nevada 142%, and Arkansas 138%. Now, these are a lot of numbers, and a lot of you are wondering, what is the point of all this? Why does it matter? Now, the problem is that if we can't afford this as a country, just initially getting it off the ground, then how are we supposed to afford it in the long term? With over 1.3 trillion to 2.6 million, according to the congressional budget offices, and that's not even a solid number yet. We don't even know how much this is going to cost, and we've already had it for about 7 months, and we still don't know what is this going to cost. And on top of that, according to Forbes, Scott Gottlieb, who was a healthcare advisor to Obama in 2013, only 1.4 million of the 7 million members who are now accepted were new members, which means that only 1.4 million people actually got coverage. Everybody else was simply people who had their policies taken away because they weren't considered good policies, as well as they weren't considered policies adequate to cover everyone, which is good to a certain extent, because now everyone has a payment that helps everyone else. But there are some negatives in the sense that for males, if you were a man and prior to this policy being enacted, you had a policy that you were under 25, you could afford it, it would cover everything you need, emergency accidents, as well as any work-related duties. Now you would also have to pay a higher premium, as I mentioned, 41% or higher, as well as you would also have to cover maternity leave and other medical beneficiaries that would go to women. which doesn't sound like a bad thing on a large scale, because hey, everyone should have access to healthcare, and if we all have to pay a little bit, then we all should. The problem is that if you're under the age of 25, it's very likely that you could still be living with your parents, as well as you wouldn't be able to afford these premiums. On top of that, there's also been some other issues with the fact of policies. A lot of people had the initial idea that if you had an older policy that you had been happy with for maybe the past 20, 30 years, you would be able to keep these. This would be grandfathered in with this new Affordable Health Care Act. So hey, I like my medical policy, I've had it for 20, 30 years, I'm going to be able to keep this, and it's going to be cheaper. What's to lose? The problem is that this is only something that apparently people assumed and was not actual fact. Obama had been misinformed and thus misinformed the public, when this was in fact not true, and over 6 million people lost existing policies that they had and had to adopt a newer policy that they may or may not have wanted.